Are you suffering with back arthritis pain, or you're wondering if your low back pain is being caused by arthritis? You may have had some imaging done, X-ray or MRI, that says that you have arthritis pain, but the doctor said that there's nothing you can do about it, and you're wondering what that means. These are the topics that we're going to discuss today. What is arthritis? What does it mean for you, and what can you do about it? Specifically, what things do you need to focus on to decrease your pain and get your movement back? So, what exactly is arthritis? Arthritis is abnormal bony formation that happens in any joint. We often see it in the spine because there's so many joints in the spine. You see each of the vertebrae, those are the bones, they have these little things that stick out on the side. They're called the transverse processes. And each of the transverse processes from the top vertebrae talks to the transverse process on the bottom vertebrae and forms what we call the facet joint. Now, this joint is lined with cartilage, which is kind of this spongy shock absorber, and it helps to allow the joint to be able to slide and glide and move correctly without pain. However, when our joints stop moving correctly, the cartilage gets damaged, and over time, if enough damage occurs, then your body will start to actually put bone down, and that's what arthritis is, abnormal bony formation. Now, the thing is that people often come to me and they say, I've had an X-ray and an MRI and it shows that I have arthritis in my spine, but the doctor says there's nothing that they can do about it. And this is true. With arthritis, there's nothing that you can do about your current arthritis. And honestly, it's pretty much normal. After the age of 20 or 25, we don't have direct blood supply to our discs in our spine, which means that those joints start slamming and jamming down on each other. Eventually, over time, we form arthritis. Now, when MRIs were new, we used to think like, oh my gosh, this is amazing. We're finding out that there's all this arthritis and all these nerve impingements and all these different problems and the disc problems and all of those things. Well, MRIs have been around for a while now, and what we have come to realize is that actually all of these things are kind of normal, and it's kind of just part of the aging process. Now, I would say, because I do believe that every tissue in your body is designed to heal itself as long as it's moving correctly, that it's not 100% normal, because it's actually caused by abnormal movement patterns. But that's very common in our world today. We tend to be people who are more sedentary than we used to be. We tend to be people who don't walk as much as we used to. And this has caused other problems. So I would say that arthritis in your spine is considered normal in today's society. And if you've had an MRI or X-ray and the doctor told you that there was nothing that could be done because these are air quotes around the word normal results, I would agree with that, because most people do have these kind of results with an X-ray or an MRI. However, I am going to disagree that arthritis is normal in and of itself. But that's another discussion for another day. If you have been told that you have arthritis in your low back, especially if it's been diagnosed via X-ray or MRI, understand that you are with the general population, and the people who haven't been diagnosed with it yet probably just don't know about it because they didn't have a reason to get an X-ray or an MRI, which begs the question, well, if all of these people have arthritis in their spine and they don't know about it, the logical question that you should be asking yourself now is my arthritis actually what's causing my pain? And friends, I would say that that is a very good question that you should be asking yourself. If so many people are walking around with undiagnosed low back arthritis problems, and the only reason they're undiagnosed is because they have not had pain that caused them to get an X-ray or MRI, it really should make you question, is the arthritis actually what's causing your low back pain? Most commonly in the clinic, what I see is that the arthritis causes your body to move abnormally, which causes other things to get pinched or stretched or tight or loose, and it has a secondary effect. And then that's actually what's causing your pain. And this is what the doctors have been finding as well. Now, when MRI first came out, they would see this arthritis, and they didn't know how common it was at the time. And so they would do surgery on it, and they would kind of roto-rooter That's what I call it, at least, when they go out and they clean out all the arthritis. And then after surgery, they would find that patients didn't necessarily have a relief of their symptoms, which meant that the arthritis wasn't causing the pain in the first place. So all this to say, it may not be that your arthritis is what is causing your pain, but it may be that your arthritis is what is causing a limitation in motion, which is putting stress on another structure, and that is what's causing your pain. I understand that that's not a simple answer, and I apologize for that. However, it is the truth, and I feel like it's important so you don't get conned by someone saying, oh, it's your arthritis causing your pain, just use this tool or take this drug. It's not necessarily going to help you. So now I'm going to circle back for my friends who are having low back pain, but they have not been diagnosed via X-ray or MRI, and they're wondering if it is arthritis that's causing your pain. I hope that you did listen to that previous statement, because it could be that you do have arthritis, but it may not be what is actually causing your pain. How do you know? Arthritis pain often is dull and achy, and it increases at night. The reason why it increases at night is it's an inflammatory issue. Itis means inflammation. Arth means joint. It's joint inflammation. That's actually what's causing your pain, is the joint inflammation. So the joint inflammation is what's causing your pain if it's the arthritis. Now, here's the thing about that. When you're up and moving during the day, most people don't struggle with pain. They're like, yeah, I can get up. They can even do activities. They can golf. They can run. They can jump. They can sit at their desk. They can stand. They can walk. They can do everything they want to do. But at night, when they lay down in bed or when they sit down to watch TV on the couch, that's when their pain really gets to them. Now, my primary question for these people is, if you do more activity during the day, is it worse at night or is it better at night? Because here's the thing, if your pain is caused by arthritis and activity decreases your symptoms at night, then I know that your body is actually moving correctly and it's able to heal. So the movement that you do during the day is healing, which decreases your symptoms at night. However, if the more activity you do during the day and you're not moving correctly, then that will increase your symptoms at night. So I've had some patients who, the more they do during the day, it doesn't hurt while they do it, but it makes the symptoms worse at night. Then we know that you're not moving correctly and your body is not capable of healing itself, and it needs some help understanding why it's not moving correctly. Now, if you've determined that you do have back arthritis and that is the cause of your pain, because you do have that dull, achy pain that's worse at night, what should you be focused on doing? There's two things that I want you to be focused on primarily to start with. The first thing is ice. I want to make sure that you're icing as soon as you can. And there's two really critical periods of time that I need you to be icing. The first one, I need you to be icing as soon as you're done with your activities for the day. So that could be after you cook dinner, it could be after you exercise, but when you're ready to kind of settle in for the evening, you're going to watch TV, read a book, whatever, I want you to ice for 3 to 5 minutes at that point. The next time I want you to ice is either when you get into bed or right before you go to bed. Now, some people really enjoy icing while they're laying down, so go ahead and take that ice pack to bed with you. Just lay on it for 3 to 5 minutes. Make sure that you have a little pillow under your knees to take stress off of your low back, and just relax for 3 to 5 minutes. Then toss the ice pack to the side so you can get a good night's sleep. However, some people do not like having an ice pack in their bed, and so they want to ice before they go to bed. Again, just make sure that you're lying on your back, your knees are supported in a slight bend, and ice for 3 to 5 minutes. Toss the ice pack in the freezer and head on up to bed. The second thing I need you to be doing to help your low back arthritis is make sure that your body is moving correctly. Now, it's really important to focus initially on small movements. I've had many patients come in and say, oh, I have low back arthritis, which means I need to strengthen my low back muscles. And that may be true for you, but my guess is that if you're suffering with low back arthritis, it's probably that your low back muscles, the big ones at least, the strappy ones, are actually moving too much and working too hard. What we need to do is get the little muscles. Those are the ones that control the joint and how it's moving. So we need to focus on some exercises for the little muscles. And that's what we're going to do now. All right, the first exercise I'm going to have you do is a quadruped cat camel. So you're going to start by getting on your hands and knees with your hands shoulder width apart and your knees hip width apart. Now your goal with this is to stay in the pain-free range. So you're going to arch your back up like an angry cat. You can tuck your tail underneath you as far as it feels comfortable, pain-free. And then you're going to drop everything down towards the ground, but keep those shoulder blades up nice and high and those hips up as high as you feel comfortable with. The goal is to get as much motion as you can pain-free and to move gently in between the positions. This is not a fast exercise. It's slow and steady, so you make sure you're staying in that pain-free range. For this one, I have people to do 10 to 15 reps as long as it doesn't cause pain, to make sure that you're getting those joints sliding on each other. Again, that's what's going to bring that healing. Now, you may be saying, Dr. Amy, I cannot get down on my knees like that. All right, I got another one for you. Okay, so the quadruped cat camel doesn't work for you because it hurts your knees to be in that position. Then what I'm going to have you do is find a surface that's right about at knee height, and we're going to do it in a standing position. So it's the same exercise. You're going to put your hands flat on that surface. Again, that's about knee height. And then you're going to arch up as far as you feel comfortable with and down. Now, you'll probably find that as you come down, you also get an excellent hamstring stretch, which is not a bad thing at all. And it will help to get that low back moving even better. Again, with this one, I'm going to recommend about 10 to 15 reps until you feel like those joints are gliding on each other. All right, now if you're able to do the cat camel either in quadruped or in standing, and that starts to feel easy, you feel like you have good motion through that, what's the next step? We're going to progress into a child's pose. Now, this is going to be one that you do need to be able to do on your knees. So if this hurts your knees to put this much pressure, I recommend trying a mat. If your knees still won't tolerate it, then this is not going to be a good progression for you, but we will give you one more exercise that you could do. All right, so for this one, what you're going to do is bring those knees a little bit wider than hip width apart. And actually, I like to have mine significantly wider than my hips to do my child's pose. And you're going to leave your hands where they are and sit all the way back on your heels. So that's the first step. And that may be where you want to start. That may be enough motion for you initially that makes you feel safe and comfortable and pain-free. It's super important. Now, if you feel like, well, that feels okay and I'm not struggling with that and you want to amp it up a little bit, then I recommend letting your hands slide forward. And as you get all the way down into that child's pose position, you'll get a great stretch through that low back, get that low back moving better, as well as getting those hips stretched out. Now, if you're not able to get your buttocks all the way down to your heels, I recommend using a yoga block or towels or rolled up blanket or something like that to help give you a little bit more support so you're not just kind of hanging out up there. Our last exercise is going to be a bit of a side bending exercise. So we're going to start on our hands and knees and we're going to curl from side to side. Okay, so again, you're going to get on your hands and knees, but instead of going front and back like we did with the cat camel earlier, you're going to go side to side. So you're going to curl over to the side like you're trying to bring, in this case, my right shoulder towards my right hip. And then you're going to curl over to the other side, trying to bring your left shoulder towards your left hip. Now again, with this one, you need to stay in that pain-free range, and you're going to do about 10 to 15 reps. You may feel a gentle stretch You may feel more than a gentle stretch, and that's okay as long as it feels like a good stretch, as long as it feels like things are moving very fluidly and there's no pain. If that one reproduces your symptoms, then it's just not the exercise that you're ready for yet. I encourage you to do the other exercises that we discussed earlier before you progress on to this one. There's some exercises, some tips, and some discussion of what is going on with low back arthritis. If you'd like to understand how movement is life and how your whole entire body is connected and everything works together, I definitely encourage you to get a copy of my new book. We'll link it in the comments below.